This might look a little bit strange, but what I am doing here is I'm using this paper clip to test my sensitivity on my legs. I'm doing this because some people have asked how much feeling I have because I'm paralysed. So I practically just zoned up my legs with this blue marker, and wherever there is blue, it means that I can feel it when I poke myself with this paper clip, and everything else is just numb.
Now you may ask why I'm actually numb, and I have a spinal injury. With spinal injuries, you can either have a complete spinal injury or an incomplete. And like you can probably guess, a complete spinal injury means there are no nerves getting through whatsoever, whereas an incomplete means there are some nerve signals, so you might have a bit of feeling or a little bit of movement, but not entirely everything. So I have an example here with some pasta, and this piece of pasta right here is, I have chopped it. So you can see that there's no nerve signals would be getting through if this was our spinal cord. And this piece over here is an example of an incomplete spinal injury because I have mashed the piece of pasta with a fork and it's a little bit broken, but there are some strands still in contact, which would be an example of an incomplete because you'd still get some nerves coming through.
As I have a T10 spinal injury, my sensitivity levels do vary up my back as well as my legs. So with a lot of people, it's not just that the legs that are affected, it may be their back or even higher as well.
Now I'm going to do the same thing with this tissue using an orange marker, and this will show light touch or pressure.
So that is the reason why I have zoned up my legs, and you can see that I do have an incomplete spinal injury, so I have a little bit of feeling through that comes through to my legs, and you can see where I have the feeling and how much I have.
So you can see we have some interesting things going on here. Like you can see here with my leg, this area is only sensitive to the touch of the paperclip, and here is sensitive to the tissue. And a spot like here is completely numb, and this area sensitive to both.
And where you have the feeling then shows where the damage is in your spinal cord. So doctors can then see what parts of your spinal cord is damaged, which is kind of cool in a way.
When I was in hospital, about once a week, my physios would do the same test by marking up my legs to determine the sensitivity levels to see if my spinal injury was any better or not. And this is called an Asia test.
Now, I have to take regular blood tests about every 2 months or so. And by using these patches on my leg to determine my sensitivity, I've worked out that I can get my bloods taken in these patches, like my feet, where I have no feeling. So at the moment, I get my blood taken right here because I can't feel it, which is pretty cool when you think about it. It's really weird, but in a zone on my leg like this, for example, it would mean that if I cut myself, I would have no knowledge of it. But if I touched myself with a feather, I would be able to feel it. Now for the spinal test, I'll be doing it on temperature sensitivity. So with this one, I've got some ice in this plastic bag, and I'm practically gonna do the same thing. You can see with these zones that I've created, right here, I have practically normal feeling. As you can see that I've marked up, I have normal temperature feeling, light touch, and pain, which is really good. But very close to it is almost practically numb. And then right next to that, I just have the light touch.
I hope you have enjoyed and found this video interesting, and if so, please keep watching for more videos.